When I was a child in primary school, I remember that we used to have doctors and nurses coming from outside to give us vaccination. I was really surprised and I started asking questions around me to teachers like, why are we vaccinated? And they explained to me that it was to prevent us from getting sick. That vaccine was a powerful tool to prevent the disease. Then I went back to home and talked to my mom about the vaccination, and she was so happy. And then she said, yeah, my son, you won't be sick, and then you'll be able to go to school to become a doctor. I worked hard at school and I decided to go for my medical school. But before that, when that happened, I now pay attention around me, and there were some children at school on wheelchair, and I was told that they get a virus that we call polio, and they will never work in their life anymore. That was sad because those children couldn't play with us, couldn't play football. I was a soccer fan, and when I was going to church on Sunday, I noticed many people around the church sitting on wheelchair begging for money. And I was told that they were also having the polio virus and they were not able to work to go to school like me. I felt sad. Then I decided to be a doctor to help with vaccine. I went to medical school and that idea grew on me, and that was re-emphasized by the fact that I learned later on that immunization was not the most cost-effective intervention in public health, but also it was a very good tool to fight poverty. And I was coming from a low middle-income country with a lot of poverty. Then I understood that I can be an actor playing to help children go to school without having that crippling disease, to be a doctor like me. I became a doctor and then I worked on immunization. And this polio was eradicated in all continents, even in Africa, because not only the vaccine was there, but also decision makers play a vital role to have that achievement. I remember the Global Polio Eradication Initiative, who made tremendous effort in terms of policy design to really help professionals, really help technicians to leverage the effect of vaccine with the vaccination. And today we're happy to see that we have eradicated polio nearly all over the world. But today we are facing another virus, not the polio virus, but the coronavirus. And again, I'm calling to scientists who are already fighting, working days and nights, tirelessly to produce vaccines. But they need you, decision maker. They need you here. Because you did it before with polio. We need you. We need your power to really make sure that we not only have vaccine, but we can have vaccination. Yes, you play a big role for that. And now we have initiative like COVAX initiative that we need your support to make sure that the quality and safe vaccines can reach the most in need everywhere they are, because vaccine works and it works for all. And today I'm calling upon you to really make sure that you can help those scientists by the policy needed for the fight against the pandemic to come to an end. Yes, we can do that because vaccine work. Vaccines work everywhere for all. Please, we are calling upon you again to say that we've done that before with polio, we can do that with the coronavirus. The victory is ours because we have the vaccine. But by themselves, vaccines can work. We need policy to make sure that the most in need, everywhere they are, can have that vaccine. Because no one is safe until everyone is safe. Vaccines work. Please let us do what we know how to do. We can do it. We can defeat the coronavirus. Thank you very much for your support.